has redefined the landscape of medical care in Nigeria with an audacious mission to hold medical tourism and embed local expertise. His academic odyssey is nothing short of remarkable. An MBBS from Usman Danfodio University, Sokoto, he laid the foundation, followed by an MSc from prestigious University of Leeds, United Kingdom, and a PhD in nuclear medicine from Hull York Medical School in collaboration with Hull and East Yorkshire Hospital, NHS Trust, United Kingdom, where he honored his expertise in advancing medical practice. Capping his academic prowess, he earned an MBA from International University of Applied Science, Germany, and an honorary doctorate and business administration from Institute of Leadership Management, Manpower and Management Development, alongside allied professional certifications from the University, United Kingdom, blending medical mastery with strategic acumen. He has received several prestigious awards from home and abroad, including the Award of Business and Innovation by the British Council. Dr. Aliyu's career is a dynamic tapestry of academic leadership and innovation. As MD CEO of FORESIGHT Healthcare Limited, he ignited a revolution to make Nigeria a West African medical tourism hub. Launching a specialist clinic and diagnostic center in Abuja, he commands FORESIGHT premier hospitals across Abuja, Kaduna, Sokoto, and Gombe, delivering world-class care as executive vice chairman of Sahad Hospitals and a 200-bed cutting-edge facility commissioned on August 31st, 2024 by His Excellency the Vice President Senator Kashim Shettima. It drives affordable patient-centered care with advanced technology like a 1.5 Tesla MRI, 64-slice CT scanner, 7 operating theater, and 13 dialysis machine. His leadership extends to the Sokoto State Advanced Medical Diagnosis Center and Katsina Dialysis Center, tackling critical health challenges like kidney disease with precision and compassion. Dr. Aliyu's bold vision, fueled by strategic partnership and a commitment to subsidize accessible care, has aligned with his national health reforms, attracting over $64 million in foreign investment to build 7 nuclear centers across Nigeria within the existing teaching hospitals, and the first center to be established is within the Usman Danfodio University Teaching Hospital in 3 months ago. Ladies and gentlemen, I'm going to welcome a medical technocrat and an entrepreneur of the highest standard, Dr. SHAMSUDDEN ALIYU. So I
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. Mr. Chairman, due to time factor, permit me to stand on the existing protocol. The title of this presentation is Harnessing the Technology and Innovation, a New Era for Medicine in Sokoto. The goal of this presentation today is to explore how we in Sokoto can leverage this revolution to build a more resilient, accessible, and effective healthcare system. The challenges and the opportunities. The challenges that we face today is geographical barriers and limited infrastructures, resource constraints and funding gaps, the need to improve patient outcome and efficiency, and the opportunity to overcome these challenges using technology. Technology in diagnosis. The objective is to achieve faster, more accurate, and more accessible diagnosis. The key technologies we can harness here is artificial intelligence, telemedicine, and wearable devices. There are numerous artificial intelligence that can be used for reading X-rays, CT scans, MRI to detect subtle anomalies. And we can also use telemedicine to enable remote consultations, specialist referral, reducing need for patients to travel long distance. And we also have many wearable devices and Internet of Things to help us efficiently manage healthcare. The artificial intelligence. IA is changing how we interpret medical images from X-rays and CT scans to MRI and ultrasound. The goal is not to replace the radiologist, but to provide powerful assistance that works tirelessly to improve speed, accuracy, and efficiency. What I can do and the benefit we can harness from it is improving the accuracy, enhancing efficiency, reduce workload and fatigue so that radiologists can focus on more complex procedures, and the common procedures will be managed by the AI. And it can also help us in quantitative analysis of the data, because all the data are quantitative in nature. Clinically, we can use artificial intelligence in numerous diseases, such as detection of cancer, which we have a special software that can be used in isolating lung cancers, which is called IARAD. It is a software designed by Siemens to detect lung cancer. And there are numerous IA that is there to help in doing so many things like that. There are other softwares that could help in detecting fractures. They are the one used for detecting neurological diseases. I will provide the slices. There are links there where we can learn more about these softwares. We can download them and we can use them in our daily practice. Beyond diagnosis, the artificial intelligence can also help in smart work lists. AI system exists that can automatically triage incoming studies, pushing the most critical cases to the top of the queue. So in the DICOM viewer or in the teleradiology system, you will have an IA. As the images are dropping from the machines, from the workstation, the IA can actually detect the complex images to be reported, so the radiologist can focus on the more complex rather than the first imaging that came to him. That will also help to improve the efficiency of the reporting and to help him manage his time effectively. And some IA can actually help for automatic reporting. Some simple procedures, you may find out that while you're reporting as a radiologist, some of the images are normal findings. AI can help you eliminate those ones so that you focus more on the complex images. The fear of AI to replace doctors is out of the question. It's just to complement what we can do. It can also help in predicting patients' outcome. There are some AI that are called AI doctor. They read radiology reports, other physician reports to predict patients' outcomes. It's embedded in an electronic information system and radiology information system of the patient to put all of those data together and predict the outcome of the patients in the future. Image optimization is one of the benefits. Research and education software AI also exists. Telemedicine. With this life we're having, an expensive life, the fuel price has skyrocketed. This is a time where we can harness the benefit of telemedicine to reduce the travel the patient has to endure to meet a physician, especially in primary health care. Our keynote speaker stressed the need for doctors to manage primary health care. I believe with the shortest number of the doctors we have in present time will make that impossible to do, but with the use of telemedicine, we will be able to benefit from that. The key benefits of telemedicine include increased access to care, cost effectiveness, improved chronic disease management like hypertension, diabetes. Patient doesn't need to visit the hospital openly. Sometime in the past in the UK, I know there is a development of group consultations. Instead of the patients to come into the hospital, the consultant will sit down and make a group phone call to his patients to make it like a discussions. And that helped a lot. But with this, it will help even more. And then enhance medical education and training. The real application of telemedicine includes rural care clinic, as I mentioned before, post-operative care, which will help in reducing long stay in the hospitals. The patient can go back home, and then the physician can manage the patient out of the hospitals. Mental health services to reduce stigma. Some of the patient doesn't want to visit a mental health clinic, but with telemedicine, you'll find out that the psychiatrist can be able to see his patients without having to subject them to coming to the hospital. And also use radiology and pathology, store and forward approach, which the images are stored, is not a live interaction. It is after storage. The slices can be sent to a pathologist, or images could be sent to radiologists for reporting. These are some of the real applications of telemedicine, which teleradiology is sub of the telemedicine. The challenges we will have is internet, of course, but the developers can actually develop low bandwidth softwares that can stand low internet for us to harness this, especially in the rural areas. And also data protection is the fear, which the users are encouraged to use a secure and encrypted platform and follow strict data protection guidelines. And also government to make a policy in using telemedicine intervention. The future of telemedicine in Sokoto is not just a temporary fix. It is a fundamental part of modern, resilient healthcare system. It has the potential to decentralize healthcare, bring specialist services to the most vulnerable populations, and empower our medical community. Let's work together to build this technology infrastructure, digital infrastructure, and professional skills needed to make this a reality for everyone in Sokoto. Now, coming to the wearables and the Internet of Things. There are numerous wearable devices that could be used, such as smartwatches, fitness tracker, and smart patches. The Internet of Things is a network of physical objects embedded with sensors, software, and other technologies to connect and exchange data with other devices and systems over the Internet. We now have glucometers that the patient can have at home, but as soon as he takes a fasting blood sugar, it will automatically update his file in the hospital. so the physician can keep track of what he's doing. Endocrinologist can look and just review his medication and communicate to him based on the update he's receiving, daily updates of the records that the patient has from wherever he is. There are many wearable diseases, wearable devices, as I've mentioned here. Even smart jewelry. There are smart jewelries that a lady can wear, and it will just be monitoring vital signs. The real-time application of these wearable devices are vital signs, continuous monitoring of heart rate, blood pressure, and oxygen saturation. These invaluable for patients with chronic health condition. Activity and sleep, glucose monitoring, as I mentioned, even fall detection. There are some wearables that, especially in the hospice, elderly or geriatric hospitals, nurses can be able to monitor whether the patient has fallen, and they will quickly come to the rescue of the patients without having to use any alarm system. I've mentioned this, chronic disease monitoring, post-operative care, and preventative medicine. The challenges of these wearables, because they are taking continuous data, there's going to be a data overload, which the solution is having an AI that could actually interpret the data received, data security issue, affordability and accessibility, and regulations. Coming to technology in medical education, we have technologies such as virtual and augmented reality, e-learning and massive online courses, and simulation labs. I have to rush because they said I have 3 minutes. There's also an evolution in medical education where previously we know the use of textbooks and hands-on on patients. Now with simulations and virtual reality, we don't even have to use the real cadavers in learning our anatomies. Because with virtual reality, you feel like you are actually doing the real thing, but you are using a virtual reality. There is also gamification as well. Using a patient and a medical student can actually be interacting with the patient with the game as if he's actually with the real patient. In 2019, there is a collaboration between NHS and the Oxford University to design a game that helps in diabetic management. There's a video here, it's long, that explains exactly how the patients and doctors are interacting with the model as if it is a real patient. E-learning, big data and AI in curriculum design. Because of the update in medicine, AI can actually continuously updating the medical curriculum with the real happening in medical world. Technology in service delivery, I've mentioned this, electronic health record, remote patient monitoring, appointment and prescription apps. Yes, we all talked about this. And there are also an AI device that is called Clinical Detection Support System. It's an AI tool that provides doctors with evidence-based recommendation at the point of care. So taking advantage of all the available data of the patients within the electronic information system, because these are also embedded in an EMR to be able to advise the doctor at the point of giving care what is the best action to take for the patient. AI can also help in smart triaging. AI can analyze patient data and symptoms to provide who needs to be seen first in the hospital or clinic, improving efficiency and outcome. Automated scheduling of patients and automated reporting as well. Our part here is embark lifelong learning, continuously updating our skills to use these new tools effectively, advocate for policy for the government to design a policy on how to use this tool, and foster local innovation to support and encourage the development of homegrown solutions that are tailored to our unique challenges. In conclusion, the technology is not just a tool, it is a foundation for a more integrated, efficient, and patient-centered healthcare system. By embracing these innovations, we can enhance the quality of care, improve patient safety, and make health services accessible to all. The future of medicine's medical services delivery is digital, connected, and collaborative. Thank you very much.
Number